Dr. Lewis. So good to see you.
Yes, sir.
Happy you made that recovery. How are you feeling this morning?
I'm doing. Good morning, sir. Thank you for having me. I'm feeling great. I'm actually making good progress and getting along very well. So thank you for asking.
And it looks like you're back at work as well. Can you describe what living with this is like months after your diagnosis? We've gotten a lot of viewer questions about that part of this.
Yes, sir. Certainly it was quite the ordeal to go through, and it took a dominant part of my life for near 2.5 months. At this point, I continue to make recoveries, continue to do well. I'm one of the blessed ones who seem to be recovering quite normally, but still I'm dealing with some of the side effects from the issues with the blood clots, for example, and some blood pressure issues that arose with the disease that continue to be present. But in general, I'm making good recoveries. As the reporter alluded to earlier, there are times of fatigue that come on, but those seem to be improving well as time goes on. And I'm just very blessed to have made the recovery that I have. But it continues to be top of mind. It continues to be an ongoing issue.
How did they treat you, if you don't mind me asking? What was the course of treatment?
Well, certainly treatment at that point in early April was different. We tried some medications and really supportive care with the ventilator. Medications such as remdesivir were not readily available at that point. My health system, Ballot Health, is moving forward with clinical trials to treat with convalescent plasma, but that had not started at the time I was in the hospital there, and they're seeing some promising results with that. But my care was really supportive in nature for the most part, just giving me the oxygen and things that I needed and controlling the symptoms as best they could with medications for that.
You mentioned to your local paper, the Tennessean, that you hope people will hear your story, see your story, and wear the mask and avoid those crowds. What's your message to people who are not taking that advice seriously?
Well, I think the message would primarily just be that this is a very real virus. This is an apolitical virus. The virus doesn't care about political affiliation. It is certainly very present and it's very real. You could ask any of the wonderful staff members who cared for me during my time in the hospital. You could ask my family that I was isolated from for near 2 months. Then they would tell you that indeed the virus is very real. I would say that you need to wear a mask not only for yourself, but also for your family. As a family physician, we treat all ages. And the mask helps protect not only yourself, but also those around you, from the children to the elderly that are in your family, from your neighbors and those folks in your communities. They help protect that. So I would please just passionately ask that you wear a mask, that you social distance as much as possible, limit your interactions, and together we can get a handle on this virus.
Dr. Lewis, why do you think it is that there are still so many people who need to hear that warning that you just laid out so eloquently? Why do you think that there are still so many people in this country who aren't taking it seriously?
I think with this being a novel process and a new virus we haven't seen before, and really with viruses such as this not really affecting the United States as much in the past, it's a new experience for some folks. Blessedly, and I hope continually, there'll be folks that won't have to have interactions with people with coronavirus within their families or their neighborhoods. But as the numbers go up, we see that happening more and more. I think obviously experience is a great teacher, but I hope it's one that we can begin to heed the warnings about and begin to really grasp the severity of what this virus can be for individuals before it has to strike someone in your family or someone you know for you to take it seriously.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.